Someone's watching me record myself. Hi, it's been about a month or so since I've made a video, and I wanted to just update where I'm at with things. I talked to a friend today and updated him, and I thought, well, I should probably just make a video because I'm starting chemo tomorrow, so this is big for me. It's been such a long time coming since last October 2017 getting a diagnosis, and now we're at June 18th 2018, so it's been a long time coming. Some people get chemo a few days after they're diagnosed. You know, there's a lot of ways it can be done. I've been doing Herceptin since January of this year. So tomorrow I'll be getting TCHP, taxotere carboplatin Herceptin Perjeta, and that's the typical or atypical regimen that somebody in my position with the type of cancer I have would do. It's HER2 positive, triple positive, and I'll be getting that in Grass Valley up here at Sierra Nevada Memorial Hospital. And the plan is to do that for 6 treatments, which will take me all the way through October of this year, because they'll be spread out every 3 weeks. And so 3 weeks ago from tomorrow, I had Herceptin and all the video is screwed up, but I think the audio is still working. So, yeah, so I'll continue to get the chemo rounds every 3 weeks, and if you do the math, that takes me into October. And then at that point, I have already scheduled my appointment with Dr. Durbis at Stanford for a surgical follow-up. So I'll do that, and that feels like a long ways off, October, but I'm sure it'll probably come quicker than... Oh, the video is totally screwed up. Quicker than I realized, and as you can see, my head is still shaved. I'm pretty used to it now. It seems to be pretty dandruffy for some reason. I'm not really doing anything with it. I'm not putting oil. I washed it because I'll be doing the DigniCap, which was also a long process getting to that. The DigniCap is something that the hospital provides, and it is a scalp cooling system, and it's one of the ones that are out there. There's Penguin cold caps. I looked at doing that, and that one you order from home, and you have to supply it with dry ice and take it to the treatment center and change the cap every half an hour. And the DigniCap, you put it on one time, and it's connected to the electricity, and you just wear that for the entire duration of the chemo for that day, which I think will be about 6 hours. And then you have to wear it for 2 hours after that as well. Why is this video so horrible? It might be because my phone's hot, but I really don't care. I'm just going with it, even though it's irritating me every minute or so. So I'll be the first one at the hospital that's ever used it. The ladies there, the nurses there, they're getting trained on it today for my chemo tomorrow. So I feel pretty special that I get to do that, and we'll see how it goes. I mean, they'll be experimenting on me basically, and I'm fine with that. I'm happy about that, actually. So the way the DigniCap works, well, I said part of it, you put it on, you leave it on, and you're hooked up to this machine. And the Penguin cold cap, as I read, gets down to 35 degrees below zero. So that's really cold, and a lot of women are turned off from using that system because of how cold it is. I mean, I can't really even imagine what that's like to put negative 35 degrees something on my skin. But the DigniCap gets something like 30 degrees, or I guess it's 32 degrees. So it's not frozen, or 33 degrees. And that is more tolerable, even though that's still kind of intense. So what do I need to say about that? Yeah, and then I'll sit there for 2 hours more. They'll transfer me to another part of the hospital where I will keep it on for 2 hours. And I need to do that all 6 times. And basically the goal is to keep most of my hair. That's how that works. It's not really I mean, they have studies, and the data that they have doesn't show many people keeping 100% of their hair. So it might get patchy and it might look mangy. I really don't know. I'm laughing at that. I don't know why. It's funny to think of having a mangy looking head. But if I'm able to keep some of my hair, I mean, I think that would be great, rather than being full on cue ball, as I call it. But if that happens, that happens. I don't disrespect anybody that has to lose their hair. I mean, it's actually feels like a huge privilege to even have the opportunity to use the DigniCap. No one at the hospital mentioned it to me. I had to find out about it on my own. I was just searching online, and then it came up, like, find the location nearest you that offers the DigniCap, and it said Sierra Memorial Hospital, and I was like, what do you mean? That's the one I go to. Why has nobody mentioned it? So it just turns out that they've never used it before, so they don't exactly advertise it. And the doctor, my oncologist, said that a lot of women don't want to do it, so not many women ask about it. So yeah, that's happening. That's probably most of it. I'm still really tired. That's been a theme throughout. Very tired, and a bit of a loss of concentration and a loss of memory. Just feel, I guess they say, you know, you get chemo brain, and I'm not even on the full chemo yet, so I don't know, maybe it's going to get worse than it is now, but I definitely have some sort of chemo brain from the Herceptin. Yeah, so I think that's it. That's my short update. I'm looking forward to getting this show on the road. One of the things, I guess, another thing to add is, because on the last scan, I said this in my last video, it showed that there was an improvement. There's a good chance that this TCHP regimen will show an even greater improvement, and it might turn out, I mean, the most difficult position I would be put in would be if the tumor completely goes away, and the tumor or the metastases in the left axilla, the underarm, if that also goes away. So basically showing no evidence of disease. If I get to that point, then the question will be, do I proceed with surgery, or do I just celebrate and continue on with my life? Do I get a lumpectomy? Do I get a mastectomy? I mean, I've been so convinced that I want a mastectomy for the last few months at least, because it, you know, just putting all the data together and everything I learned and all the statistics that I was presented with, I thought, okay, well, that's what I want. But now, I mean, if you have no evidence of disease in your body, do you still continue on with the mastectomy? Do you still get surgery? And I think I probably will, but luckily I don't need to make that decision right now. I have to get myself to October and try to be as healthy as I can, and then cross that bridge when I come to it. So that's there as well. Also, some people have asked me about a meal train. If you want to bring me a meal, I'm happy to have a meal. Just get in touch with me somehow through Facebook Messenger or whatever way. You could leave a comment on here. I mean, obviously you need to be local to where I live, unless one friend who isn't said she wanted to send an Amazon meal, which I didn't even know you could do. But if you are savvy like that and are interested in doing that, just let me know. Of course, I would gratefully accept your offer to help me with meals. My boyfriend is amazing, and he helps me every step of the way, and I know that he's going to be taking care of a lot. But like they say, you know, the caregiver often is in need of support, even though the patient gets all the attention. So I would love to take some of that burden off of him as well. So I have a couple people that said they wanted to organize a meal train, and I've been pretty bad about keeping in touch with them. I've been bad about keeping in touch with anybody, to be honest. It's a lot for me. Sometimes just day-to-day functions are difficult for me to keep up with. But if the meal train does get organized and there's a link, I will definitely share that so people can contribute in that way if they want to. It won't be, you know, every day between now and October. It would just be the days around chemo. That's, you know, what I'm thinking right now, for a week around each chemo, probably. The other thing is, I mean, I'm a pretty avid exerciser, and I like to do hot Pilates, and I also have been going to the gym for a little while now, and I want to continue to go to the gym. Everything that I've learned about going there is really good for somebody who's getting older, and that'd be me. And it's good for bone density and like that. So I want to keep going to the gym, but I'm just gonna have to see how it goes. It's a really big thing for me. I'm sure it is for some other people too, but giving up exercise for me and just walking, like I know I'm supposed to walk every day. That's a really good way for me to keep my circulation going and keep my health up. It's one of the things, just so I'm not like lying in bed all day. But normally walking, I mean, if someone tells me to walk, I'm like, that's just not exercise. For me, I need to be sweating bullets and soaking a towel and completely winded and pushing myself to my max. I mean, that's how I like to exercise and work out. So that's going to be a big adjustment for me, but at least I know it'll be there when I'm done. Even if I can't do one Pilates class or go to the gym once, it will be over. When I gave birth, I stopped doing yoga for a while, and it was really hard on me, but I got back into it, so I know that it'll be waiting there for me when I get done, thankfully. Oh, the other thing I was going to say, it's funny, I was going to stop like 5 minutes ago. Here's the port. Here you can see it's got this really interesting shape, and you can see a scar here and a scar at the top. I guess those scars will go away a little bit over time. They'll fade as scars do, but when the time comes to take the port out, they'll reopen this incision, remove it, and re-close it, and then over time that scar will lessen. But okay, so there's so the port, actually there's this lump here right where my finger is, and that it's like this membrane. It's really interesting looking. I don't even know what to equate that to, but a membrane on something where they literally put the needle in. They put a bunch of numbing cream. Today I had numbing cream and an ice because they drew blood, and this right here, I can actually feel the plastic piece of the port. It's going into the vena cava, which I guess is a really deep vein. The amount of blood that's flowing through there constantly is, it's a lot because it's connected right to the heart. So it's pretty freaky to think about, having something connected right to your heart like that. And sometimes when I've been in Pilates, I fear like I'm doing all these crazy things, burpees, and am I going to rip it out of my neck? And so far so good, that hasn't happened. But I've now had this thing poked twice. Once was last 3 weeks ago with the Herceptin, and then second time was today when they drew blood, and then tomorrow they'll do it as well. So I haven't met anybody who said they regretted getting this port in. It seems like a real pain in the ass, and in some ways it is. I mean, they told me I would be able to get back to my normal routine in a week, and it definitely was not a week. It was 3 weeks, because that's how long it took to not be uncomfortable anymore. And even now, when I'm playing with my daughter, the cat, I've got a kitty, and I just keep her away from here because I don't want a nail going in there, or just, I don't want her messing with it. So I'm happy right now that I have this port. I think I'll just continue to be happy because it does save the veins from getting destroyed from chemo, and it also, like 5 times out of 10, they either miss my vein, the vein rolls. I just don't have good veins, I guess. Not in the crook of my arm. They want to do it in my hand sometimes, and I'm very uncomfortable getting an IV in my hand. I have huge veins in my hands, actually, but getting them poked is really uncomfortable. So I've now, at this point, become a proponent of getting this port as well. If I do get a mastectomy, they will remove the port and do the mastectomy all at once. And the medical oncologist told me, you want that. If you have the option, you want that, because the surgeon, the plastic surgeon, the breast surgeon will do a beautiful job making sure you have the smallest scar possible, versus if you just go into interventional radiology, which is the department that put this in, they may not be as skillful and attuned to making the scar small. So these are the little nuances. I haven't worn I did wear my wig once. I wore it all day, I took my boyfriend to the airport and I wore it all the way down, 3-hour drive, and it was miserable. So it's hot. I mean, it's June and I live somewhere where the temperatures get up to 100 degrees Fahrenheit. And yeah, I found it to be really hot. So that's what I have to say about wigs. I might wear it again, or it might just end up going into my daughter's hands when I'm done with it, because I promised her that she could have it when I'm done. Okay, that was a mouthful. I'm just like little jabberjaws. Thank you for being with me, and I will update again at some point in the future. All right, take care.